Hi there, my name is Alex Knaus, and I did my research paper on health information exchanges. Now, what is a health information exchange, you might ask? It all kind of has to do with health information technology and how patient health data is shared from one provider to another. Health information exchanges allow for doctors, nurses, pharmacists, specialists, hospitals, labs. It allows you to essentially coordinate their care and appropriately access the patient's health data in a fast, secure manner to hopefully improve the quality of care, the safety of the care, all while kind of reducing the overall cost of care. So as you can see here in this diagram, you have the patient in the center, surrounded by the hospital, the laboratory, primary care specialist, and the pharmacist here. This is a pretty good diagram, essentially explaining how health information exchanges work. It puts the patient in the center, puts everyone around it, and it just allows for the easy flow of health data throughout a patient's healthcare needs. The goal is also to go paperless. If you go into a doctor's office today, you could find that all your medical data is stored in filing cabinets. Although that's the way it is, it's just not necessarily convenient. It's not the easiest to access. Say there's some sort of disaster where you could potentially lose that information. It's just a lot more manageable if you keep that data in these exchanges. Almost think of it as like storing information in the cloud. Now the bottom, the main objective is that this information has to be secure. I know that's a worry with health information exchanges. It really has to be secure when it comes to patient health information. You could violate a lot of laws. Now there's 3 different types of health information exchanges. There's a direct exchange, which through my research I found that was the most common. That's what Pennsylvania uses. A direct exchange allows for providers to securely send patient data to another healthcare professional. So, for example, if you have a primary care physician, it could be as simple as that physician sending electronic health data to maybe a specialist. So that could be medications or lab tests, just to kind of keep everybody on the same page. It could be a query-based information exchange, which allows providers to search patient data based on unforeseen care. An example of that could be perhaps you're in the ER, and if a physician can access patient info such as medications to maybe adjust how they planned on treating you based off those medications. So they see, hey, this patient has a history of this medication, it hasn't necessarily worked. Let's try a different one. Lastly, we have consumer-mediated health exchanges. It's pretty self-explanatory. That is essentially where the consumer has the general control of their health information. They can choose to share it with their providers, or they can kind of keep it to themselves. Personally, I don't know why you wouldn't want to share that with health providers, but some people just would just prefer not to. With the consumer based health information exchanges, you can elect to give providers health info. You can choose not to. You can correct potentially missing health info. It all kind of it puts the power in the consumer's hands. So the patient will be able to track and monitor their own health. So say you're taking a prescription drug and you up the dosage for that drug. You can log on to essentially like a virtual portal, and you can up that dosage in there to like I said, kind of keep everybody on the same page. Now, I wanted to kind of take a look at the current healthcare spending in the United States, because it is astronomical, as you can see here in this chart. the U.S. is the #1 healthcare spending country currently, and they've pretty much doubled the average here. So the average is about give or take $3,000, and the U.S. currently is at $8,713 per individual per year. Now, when it comes to pharmaceuticals, as you can see, the United States is once again at the top as to how much they spend on pharmaceuticals, or how much we spend on pharmaceuticals a year. Now, the goal of health information technology is to essentially drive costs down. So if we can eliminate some of these potentially unnecessary prescriptions being given out, that'll eventually, that'll cut costs for the patient and, even the providers. Now, this is a life expectancy diagram here. This is about the average. So the average is 80.1 years is the amount that the average person in this world lives. And the U.S. falls slightly below that average at 78.7, which obviously is a problem considering we spend the most on health care, yet we're not necessarily getting any results here. Now, some might say, when you go to a doctor's office, the average, I read an article where the average time a doctor spends with the patients could be anywhere from 7 to 13 minutes. Now, I personally don't think that's enough time. However, with the utilization of health information technology, it'll essentially put the doctor at a higher understanding of the patient prior to even interacting with that patient. So you walk into a doctor's office, and you say you check in on your phone. You have all your electronic health data there that you could essentially share with the provider, and essentially allow the provider to maybe see a history of what you got going on. Okay, so this patient took this medication. He was in here last week. I guess that didn't work. Maybe we'll try something else. Or the last time this patient was in, we ran these tests. So we're not going to duplicate those. Maybe we'll do another test if needed. So it's all this stuff is once again, it's all trying to drive the cost of care down. Now, a couple other interesting facts I wanted to say about the current healthcare in the United States. So we have fewer physicians per person than most countries. So I think right now we have 2.4 physicians per 1,000 people it is. There's also 2.4 hospital beds per 1,000 people. And the average hospital beds per person per 1,000 people elsewhere is 3.4. So once again, the United States slightly below that average there. So that's like I said, it all ties. We're spending this much on healthcare, and we're not seeing results. Now, some benefits to the patient. It'll improve the patient coordination, as I just said, with their doctors there. It'll improve clinical outcomes. It'll improve the transition to care. Like I said, if you see a primary care physician and they're going to refer you to a specialist, they could send that two doctors that have never met or talked to each other. They're going to be on the essentially pretty close to being on the same page when it comes to what you're going to need from that point on to prevent any sort of duplications. And it'll improve the experience to the patient, and I think most importantly, it'll increase transparency from the patient and provider. I think health information exchanges and technology will allow for patients to make more educated decisions based on their own health care. The average person doesn't really necessarily know a whole lot about health care. And if you could build confidence in a patient to essentially make strong confidence decisions on where they think or what they think they need to do in order to have better outcomes. That's kind of one of the main goals. I think transparency. I myself working in the healthcare industry. There's really, I work at a health insurance company, and to be honest with you, the transparency between us, the provider, and the patient is extremely poor. If a patient wants to come into our office and ask, how much am I going to pay for this? Say it's some sort of MRI. We can't tell them that because frankly we don't know. But yet they go to the provider, and the provider's going to tell them the same thing. So there's just not a whole lot of transparency there. So if we can build confidence in patients to make the proper educated decisions on their own care, it'll be better for everybody. Now, some benefits to the provider. It'll reduce healthcare costs. Like I said, it's going to reduce costs to the patient and the provider. Although it's great for the patient, the provider might not necessarily be as happy about that. However, it's going to reduce healthcare costs. It's going to make accessing clinical data a lot simpler. It's going to improve monitoring of patients and patient satisfaction. On top of that, it's going to prevent readmissions, and it's also going to allow providers, which is pretty interesting, it's going to allow providers to essentially pick up on trends and patterns of patients. It'll also pick up on frequent flyers, people who are high utilizers. It'll make the provider essentially be able to web everything together and be able to like I said, although the patient's going to be able to make more educated decisions, the provider is also then going to make better decisions based off the info that they're receiving. In conclusion, the utilization of health information exchanges in the United States is huge with the development of technology. I personally think that all health information should be essentially stored in these sort of networks here. Now, whereas everything's kind of state-based at this point, I would like the country itself to take a more national approach to health information exchanges. People travel. I think that there should be essentially one system that the United States uses, which bundles all patient data together. Now, there are complications to that. It's not as easy as it sounds. It's going to cost a lot of money, obviously, and like I said, there's always fear of that information getting into the wrong hands, just like online banking. But I think that one day, with all the development in technology, that all this kind of patient data is going to be stored in one place. It's going to be easily accessible. You go into a provider's office, they have all your information there. Boom. Essentially, it puts them kind of ahead of the game. Rather than starting from that ground zero. Like I said, you get referred to a specialist. Boom. They know everything that you did at that past visit. It just makes the entire process a lot less stressful on the patient, and you're just going to have better outcomes. You're going to increase the quality of care as well as reduce the cost. So that is health information exchanges.